Good evening. My name is Dr. Sam Suri. I'm a practicing cardiologist here in Fremont, California. I welcome you to our program and the CWC, which I'm a part of. And I'm delighted to be part of a very elite group that we have a part of our consortium. And I thank you for your time and attention. Being a cardiologist, I'm going to address the cardiovascular care during this past year, particularly during COVID. We have a series of 2 lectures, or perhaps a better way to put this is 2 overviews about cardiovascular healthcare. The first is on March 12th, which would be moderated by Dr. Ramachandran, and I will be one of the speakers. And Dr. Rahul Sharma from Stanford will certainly lead the show thereafter. The second will be on March 27th. That would be moderated by one of us, and I would be engaged in discussions with Dr. Rahul Sharma, who would essentially be the lead speaker. This will entail the broad spectrum of disease that we have seen during our 1 year of anniversary of the COVID pandemic, pertaining particularly to cardiovascular health. Cardiovascular disease is still the leading cause of death amongst non-COVID individuals worldwide. But unfortunately, COVID has taken over anything else during this pandemic and has resulted in cardiovascular catastrophe as well. 54% of all patients that are or have encountered COVID virus across the board will unfortunately develop some signs or symptoms in their lifetime of COVID-related comorbidities from cardiovascular disease. That's very unfortunate. That being said, we're here to take care of folks who either have had the virus and have morbidity from it, from cardiovascular disease, or not. And one of the things that we will discuss and talk about is cardiovascular health and prevention, and how to basically make sure that in this very difficult environment to maintain our standard PPEs and other social distancing measures. But thank goodness for vaccines. They are going to be life-saving, they're going to be protecting, and they're going to certainly reduce cardiovascular and other comorbidities. With this said, I would like to tell you a little bit more specifically about cardiovascular health and the COVID virus itself. Diabetes, hypertension, cardiovascular, heart failure have all been associated with higher risk of mortality from the COVID virus. And that's what I'm going to be discussing at length during our discussion on March 12th. That also will include specifically certain causes of how the heart gets inflamed. It's called myocarditis and so on and so forth. And the risk of heart disease with heart attacks during this period as well. I thank you for your attention, and it's always a delight to see you all.